Good morning, ladies and gentlemen. I've asked to speak with you today to inform you of recent events related to the powerful painkiller fentanyl. It is our duty to inform and educate parents and the general public in order to prevent harm to our citizens and to our communities. Over the recent weeks, the Vancouver Police Service have investigated the unintentional overdose deaths of individuals who consumed fentanyl, believing it was another drug altogether. Although the landscape of the problem differs between Vancouver and Toronto, it is important to examine similarities as not to be naive to the potential of shifting trends of a fluid drug culture. Fentanyl is a powerful synthetic opiate prescribed to combat severe pain. Fentanyl is approximately 50 to 100 times more powerful than morphine and is approximately 40 times more potent than heroin. When fentanyl is prescribed, patients will wear a transdermal patch, enabling the release of medication slowly over a number of days. Abusers of this drug will tamper with the patches, exposing themselves to amounts of fentanyl that are potentially lethal. Because the patch is made for a 72-hour slow release, scraping off this medication and smoking it or sucking the drug out of the patch can make a single patch, in fact, lethal. Recent reports from the deaths in Vancouver have suggested that victims purchased and overdosed from fentanyl, believing that what they had taken was oxycodone from an Oxycontin tablet. Although we have not seen the saturation of fentanyl in Toronto as of yet, imitation Oxycontin tablets containing fentanyl have also been seized on our own streets in Toronto. Also last week, the Toronto Police advised the public of a number of fentanyl patches that were stolen from a vehicle in the North York area. The perpetrator of this act, or anyone who may come into contact with these patches, may or may not know the risks involved with this substance. These incidents are of great concern to the Toronto Police Service, and there exists a need to warn the public of the potential danger with the drug fentanyl. The consumption of any drug, including fentanyl, is not one without great risks. Consumers have no way of knowing if the substance received is actually the substance it is purported to be. We see this often from incidents involving drugs that are found to contain numerous harmful and carcinogenic substances. Furthermore, consumers have no way of knowing the concentration or the purity of an acquired substance, which may lead to an accidental overdose. One has no idea how they will react to a substance or what pre-existing condition may be affected by their own consumption. Ingesting these substances in conjunction with alcohol, controlled or uncontrolled substances may be hazardous to one's health or, in fact, even lethal. I must emphasize this is not new for the Toronto drug situation. In fact, last year, Toronto Crime Stoppers created the Cooking with Molly campaign to address the very issue of people taking unknown illicit drugs. The overdose of opiates and fentanyl in a medical emergency is a medical emergency, and should you suspect that you're witnessing an overdose of this nature, you should immediately call 911. The symptoms from knowingly or unknowingly consuming fentanyl may be the following: slowed breathing, nausea, constipation, drowsiness, unconsciousness, coma, and unfortunately even potential death. I want to further remind the public of the Patch for Patch initiative that's current in Ontario. The Ontario Associations of Chief of Police commenced the Patch for Patch initiative in 2014 in an effort to prevent the abuse of fentanyl patches. The Toronto Police Service is a strong supporter of the initiative. However, we also encourage our communities to play a collaborative role in supporting this initiative. The misuse of fentanyl is having a devastating impact in many communities throughout Canada, including unnecessary deaths. The Patch for Patch initiative can assist in eliminating the availability of fentanyl patches within our community. Limiting the supply and accessibility of fentanyl patches will contribute further to enhancing the overall health and safety of our communities. Currently, fentanyl is controlled by the Controlled Drugs and Substance Act. Possession of this drug or selling this drug without a prescription is illegal. I encourage anyone with information about persons selling fentanyl patches or OxyContin tablets are asked to call the drug squad at 416-808-6100 or anonymously through Crime Stopper. At this point, I'll take any of your questions.
You said, given what you've seen with trends of drugs in the past, I mean, you said that we're seeing it in Vancouver, not necessarily here. Do you expect to see it here after seeing what's happened in Vancouver?
It's we're seeing it heavily in Western Canada. Vancouver has a more there's more people involved in the heroin use in Vancouver than there is in Toronto, and fentanyl has somewhat of a direct correlation with heroin use. It is in Ontario, it is in the GTA, it's also in Quebec. So it's only a matter of time that we should, and likely we'll see it in Toronto.
What's the correlation to heroin? Can you just explain that?
Fentanyl is an opiate, as is heroin. So one who takes heroin for their own use, the fentanyl being an opiate would have the same, somewhat of the same results for the person using it.
Is it cheaper, or is it cheaper for the drug users or the drug dealers?
It depends on how much they're using, how they're getting it. Fentanyl right now on the streets of Toronto for a patch is selling upwards to the area of $200 illegally for one patch. When they cut that down, there's a profit margin for drug traffickers, unfortunately, and the heroin by no means is a cheap drug, but the fentanyl is a more expensive drug to purchase.
So how many highs can one patch produce typically?
If they take fentanyl on its own,
Yeah.
Unlimited. If they get a patch,
If they get one patch.
if they get the patch, just depending on how they take it and how they reproduce it. What we're very concerned of right now is the fact that we're now seeing fentanyl combined with other drugs in knockoff OxyContin pills. So that's, again, one of the dangers, one of the reasons I'm here today is the fact that we're now seeing it in a different form hitting the streets in Canada.
The RCMP says that it can even be laced in pot. Is that
Sorry?
happening in Toronto? The RCMP says fentanyl can even be laced in things like pot. Is that happening in Toronto?
I have no direct knowledge that fentanyl has been laced in marijuana. I've never seen it yet in Toronto or aware of it.
Who's dying from fentanyl here in the city in Toronto? What's the character profile of that person?
There are some people who, across Canada and in fact in Toronto, who have unfortunately died from this drug. Some are traditionally heroin users, those who use heroin because of a number of reasons. They may unknowingly be taking, what we're seeing in Toronto is people who are normally taking heroin are now unknowingly taking heroin matched with fentanyl.
The Canadian Centre on Substance Abuse in Ontario says that more than 60% of the fentanyl deaths in Canada are coming from Ontario, but we're not really talking about it. Why are the bulk of the deaths coming from here, but it's not hitting the headlines?
We're seeing a lot of deaths in the Greater Toronto area, up in the 905 and 705 region of Ontario. There are an awful lot of other police agencies that are talking about it, making the public aware. I know Halton Regional Police put out a public awareness just this past week. The RCMP have, the Ontario Association Chief of Police have. Once again, one of my messages here today, and the reason I've asked the media to come down, is to strongly support the Patch to Patch program initiative that's out there. There's the Patch for Patch initiative is a volunteer initiative right now. It is a private member's bill. It's Bill 33. It's gone through a second reading at Queen's Park, and we're hoping from Ontario Association of Police that it becomes law. Once it becomes law on the Patch to Patch, if someone is to receive their prescribed drugs of fentanyl, or if they receive hypothetically 10 patches, if the law comes into place, in order to get their next prescription, they have to return the 10 used ones. So that would be a great bonus in helping the police, helping the safety of the community. So we're hoping that bill does get final assent.
So right now, it doesn't exist, patch for patch?
It does. It exists as a initiative right now, supported by the Ontario Association of Police, supported by the pharmacies as well, and the physicians. So it's a strong initiative, and it is working well in some communities. And again, the pharmacists are supporting as well as the physicians.
Here in
How many
Toronto,
people have
it's,
died in the GTA from, in connection to fentanyl use? Because we have numbers in BC and Alberta, but I've never heard any for the GTA.
We don't have the specific statistics as far as the GTA goes. We are working, Toronto Police are working with the coroner's office in relation to the deaths and the numbers, but I don't have the specific numbers to give you.
How about for just Toronto then?
We don't have those numbers.
Inspector, Canadians have sort of a dubious honor of kind of large drug labs, where in the US they tend to be more sort of little attic-based things, and especially with meth, there's been, you can make meth with some fairly commonly available industrial chemicals without giving up any secrets. Is this stuff the kind of thing that somebody could produce at a home or garage lab?
Unfortunately, yes. It's like any drug, a clandestine lab. You could produce this particular drug. The pills that you see on the screen right now are what's purported to be a knockoff Oxycontin. It's a Toronto police seizure of these pills. Unfortunately, they did contain, all these pills contain fentanyl. So your question, Cam, yes, can they make fentanyl in the same way they can make other particular synthetic drugs? The answer is yes.
How many of those pills could kill someone?
Sorry?
How many of those pills could kill a person?
Well, it's like any drug. There's so many variables. That's the danger of taking any illicit drug. I mean, we're here today talking about the dangers of fentanyl, but any drug, whether it's MDMA, whether it's cocaine, one pill could kill a person. But that's with any drug. There's the makeup of your own self, what you've taken beforehand. You know, we had this in the past years with MDMA, you know, which is referred to Molly now. But yeah, I mean, absolutely, one pill could kill you.
How are dealers getting their hands on patches?
Sorry?
How are dealers getting their hands on patches predominantly?
One of the issues and one of the what we're trying to promote for an education aspect is the proper disposal by those who are legally obtaining it. The problem is with fentanyl is they do come in a transdermal patch, and even though when someone who's prescribed legally with it, if they're not disposing of it properly and someone's able to get the remaining of that patch, they're still going to get some of the remnants of the drug in that patch. So some of it's just as easy as, you know, if breaking into people's homes, stealing from the garbage, there's that area. Then there's also the clandestine lab side.
How prevalent is it that people with actual legitimate prescriptions are then turning and selling a portion of what they get to other people?
It's a concern for us. I don't have the specific numbers, but it is one of the ways it's getting out on the street that some people, unfortunately, who are prescribed it, are selling some of their patches.
Talked about the problems that Western Canada is having with this, the deaths that they've experienced. And I've read in several different stories that it's taking, the drug is taking traditional drug routes. I can only assume that means that it's just moving itself across Canada, which is why we're standing here today and talking about it. How alarming is this for Toronto Police against the backdrop of what's happening in Western Canada?
Again, we're seeing some instances right now in Toronto. What we're staying on top of is one of the proactive issues we're doing from an investigative side is anything that we see that's of an opiate product. We are now with Health Canada, working with Health Canada, quantifying what the drug is to see if we are getting fentanyl. So that's one of the issues we're doing. We're learning ourselves to try and see where the drug is being hidden, because what happens is, like I was saying earlier, fentanyl is being mixed. What we're seeing in Toronto more is the fact that fentanyl is being mixed in with the heroin, and that's what's causing the issues here in Toronto. And those who traditionally are taking heroin are unknowingly taking fentanyl blended with heroin, which has some strong dangers to it.
Can you tell us about this seizure? Where did this come from? What were the circumstances?
I can't speak of it specifically because it's an active investigation, but it was from a downtown Toronto location, and it was part of a larger investigation.
And you think that these are being sold pill for pill on the streets downtown?
That's not how the investigation started, but it's certainly, with the numbers of pills that we got, that would be the conclusion.
How many pills in that bag? Does anyone count them?
There's approximately 100.
What about the
And
20?
how much would each pill go for on the street?
Again, it depends on what they're holding it out to be. As far as the trafficker goes, it could go up to $100 a pill.
So
And
they
what-
say that it's mixed with fentanyl, or do you mean if they just?
Depending, again, depending on what the street name they're trying to purport it out to be. These are knockoff OxyContin pills, fraudulent OxyContin pills. If they're trying to sell it as OxyContin, OxyContin on its own on the street can go anywhere between $10 and $80 depending on the milligram strength, as far as on the black market in the street. So if they're holding it out to be OxyContin on its own, or oxycodone, it could have a high price. But again, with these pills having fentanyl, not only will there be a high price, there'll be a high price to pay for those taking it.
So what else is in these pills?
There was a mixture. There was some other opiates in it, but the majority of the substance was found to be fentanyl.
And would the people know that, like, would this go by a different name, or people are just being told this is Oxy and that's wrong?
This investigation specifically, I can't say because it was part of a larger investigation. What it appears to be, from what we're seeing across the country, including here in Ontario, is often the dealers themselves are just purporting it to be Oxy that they're selling. Again, the problem with any type of pill, and I want to make this clear, the problem with any type of pill, whether it's Molly or whether it's fentanyl, the problem is most of them are made in clandestine labs. A lot of it has different substances in it, all of them dangerous on their own. Often the dealers themselves at the lower end really themselves don't know what they're selling. They may be purporting it to be Oxy because maybe they bought it themselves believing it was Oxy, and they themselves don't know what they're selling. That's the dangers of whenever you put a illicit drug into a pill.
So you're encouraging people to call in if they see an overdose, but last week someone did in Oakville and they got arrested and charged with possession. So isn't that going to deter people from calling?
I can't speak for the Halton investigation. I'm aware of the one that you're talking about. I can't speak to their investigation. All I know is we want people to live. We don't want people harmed by this drug. So I'm here today to hopefully through the media is to warn people of the dangers of this particular drug. Once again, I can't speak for another agency's investigation.
When was this seizure?
This was seized in late 2013.
Have you had another big one like this?
We've had a number of seizures, but not as large as this.
Okay, so this was 2013, so obviously this has been on your radar for a while.
Correct.
Okay, so I know this was asked before, but I have to ask it again because it just seems very unfinished. Is there any way of quantifying deaths due to this in the GTA or even Toronto proper? Is there any way of saying, you know, in the last 6 months, we've seen X number of people fatally overdosed because of this stuff?
Again, we're currently working with the coroner's office. Any drug, whether it's a pill, a powder, whatever package it comes in, for the Toronto Police to be able to say specifically it's fentanyl or fentanyl related, we have to get that from the coroner's office. I can tell you right now that the drug squad is currently working with the coroner's office in relation to deaths and the drugs involved in the death or the suspected drugs. So I can tell you that right now we're working with them.
So why doesn't Toronto Police have any numbers on this yet?
On which one?
On how many deaths this has caused?
That's what we're working with the coroner's office right now.
Can you tell us a rough number of suspected deaths?
No, I don't have those numbers, I'm sorry.
So is Toronto Police still being caught by surprise with this on the street? I mean, obviously this is coming, you know, across from the west.
No, not at all. Toronto Police have educated the public before on individual press release. One of the reasons I'm here today is because of the fact that we had the theft of the patches in North York last week, but obviously they're still out there somewhere. someone broke in. So this isn't the first time that Toronto Police have come out and cautioned the public. So by no means are we caught by surprise. We want to be proactive here. We want to make sure that we're warning the public in regards to this drug.
Can you reiterate what happened in that theft? That was in North York last week.
Someone broke into a car and were able to take 10 patches. Or sorry, 20 patches, I believe, sorry.
It was parked outside a doctor's office.
I don't know exactly where it was parked, but it was a unoccupied vehicle, and someone was able to break into it.
Did the vehicle belong to someone who prescribed?
Yes, yes.
Why is it being prescribed? Can you clarify that? Who's actually taking it legally?
People with chronic pain. That's what fentanyl has some very good. It's a very good drug for people who have chronic pain. It's that's the intention of the drug when it's used properly and prescribed.
Do police carry naloxone with them when they?
Do the police what? Sorry.
Naloxone, the antidote for opiates, reversing overdoses.
Would this fall in the same thing? Yes. Do the police carry it? No.
Yeah, do the police carry it when responding to overdoses?
No, not in Toronto.
So what can be done at this point? I mean, if we're talking about hardcore addicts who are taking heroin or oxycodone or whatever, simply coming out and saying, don't do that because it could be harmful to you, it's not going to matter much to someone who's addicted. So what can be done in those cases where people are just addicted beyond control? What can be done to help them?
Well, it's an awareness of, I mean, I'm not certainly staying here in charge of the drug squad talking about the selling of illicit drugs, but I'd be naive to know that's not taking place. So those who are buying it from their dealers, they better have an understanding with that particular person of what they're buying versus the unknowing buying of perhaps fentanyl mixed with heroin. Again, if someone knowingly is buying fentanyl, if it's offered and they think, my main message here today, if someone is knowingly buying fentanyl or want to try fentanyl for the first time thinking this is the greatest new drug out there, my message is don't do it. Don't do it. I mean, this is a dangerous drug. So your question is, well, hardcore, it's just know what you're getting, know what's in that package or that. The problem is once it's in a pill, you don't know what you're getting. These aren't made in a laboratory. These are illicit labs, so you don't know what you're getting. But again, my strong message is that, people will experiment. And I know you asked the question about hardcore, but I'll revert back to someone who's experimenting. If they're going to experiment and they think this is going to be something that they want to try, my strongest message I can give is to parents, to the public is stay away from this drug. This drug is dangerous.
But the fact of the matter is the majority of cases, the vast majority of deaths and that in Toronto is that people are taking it by accident, correct?
Well, what we're seeing in some of them is the blend. That's what we're seeing in Toronto is the blend. Heroin blended with fentanyl. That's what we're seeing. Out in Vancouver, it may be different. Toronto, it's a blend of the two drugs. So,
Do people know the blend exists?
no, I don't think they do. From all the sources that we've talked to at the drug squad, and we certainly have our street sources that talk to us, and that certainly assists us in the drug squad as well, is the use of this particular drug in Toronto is the blended use of heroin and fentanyl, and most people who are taking it think they're taking heroin.
And is this a party scene?
No, it's not like Molly. This is, this is 40 times more potent than heroin on its own. So it's generally a different type of individual that would normally use an opiate, which is fentanyl. Fentanyl is part of the opiate family.
Are most of the deaths and overdoses you're seeing coming from illegal patch diversion, or is it a powder that's being mixed?
Well, we're seeing it mostly in a powder. We have seen some where they've actually are chewing parts of the patch. So the thing is, with any type of drug that's contains a gel or a liquid at its beginning state, you can easily turn that into a powder form. So although we're seeing it possibly in a powder form into the pill form, it still starts off as the gel form or the liquid form. But we're also seeing people taking it at the source, just breaking it off from a transdermal patch.
Are you seeing people smuggling it into the
Sorry?
country? Is it being smuggled into the country? Like in the report, it said it's coming from China.
Not from what we've seen. It's in country. It's like any drug, it could be, but that's not what we're seeing.
The makeup of Oxy was changed to make it more difficult for people to take recreationally, and do you think that's going to have an impact on this? Now, this is easier to get than Oxy was?
It could, Cam. Once again, this certainly has concern for us because we don't know exactly how they're purporting the, out in the street level, how they're purporting the Oxy to be, or whether in fact the person selling the counterfeit Oxy even know that it does contain fentanyl. From my strong belief, I think people at the street level selling may not even know that they're selling something other than counterfeit Oxy.
At this point, if one of your undercover officers wanted to go to try to buy fentanyl, as far as you know, it wouldn't be easy just to walk into some park and say, hey, you know where I can find fentanyl? It's not at that level yet?
No, you're absolutely correct. You may get it through an Oxy pill or a purported Oxy pill, or you may get it through heroin. Again, the street dealer believing that they're selling you heroin when in fact they're selling you a blend. Can you still get by straight fentanyl illicitly in Toronto? Yes, but it wouldn't be as common as or prevalent as street level crack cocaine or heroin.
Let's take one more question.
If fentanyl is more expensive than the other drugs that you're mentioning, heroin and Oxy, why would anybody put them in these drugs and then sell them for less? I don't understand.
Yeah, because of the because it's such a strong drug and because it's so much stronger than other traditional drugs like heroin, the dealer can profit more by the way that they sell the product, by the way they dilute the product.
So they put less in it, is that right?
Sorry?
Essentially, they put smaller quantities in it.
And use a cutting agent. Again, I'm being very careful here because I don't want to educate drug traffickers. There's a fine line in my answering of these questions, and I hope you can appreciate of answering your questions, which I want to do, and not kind of tipping off people who want to be drug traffickers.
And those 20 patches are still at large?
As far as I know, I actually checked with 32 Division today. It's a 32 Division lead investigation. As far as I know, yes.
So who are the people trafficking mostly? Big gangs, organized crime?
What we're seeing at the street level, it's those who would be selling pills, those who would be selling heroin, are the same ones that are selling fentanyl.
That concludes today's conference. Thank you for attending.
Thank you.
I have the YouTube video if anybody does want to see it about cooking with Molly. Again, it's not the same, but if you're interested in seeing it, I can show it. Also, it's available on YouTube.